There it goes. All right. So when we talk about repair, these are kind of important. And the main reason for that is these are some of the bones that make up or are some of the ones that are involved in the actual repair process themselves. So you can see we've got the osteocytes. Those are what normally are what we refer to as mature bone cells. So in forensics, if we're trying to identify a skeleton and we look underneath a microscope and see lots and lots of these osteocytes, we most likely have a mature individual. All right. The osteoblasts, these guys are what are referred to as bone building cells. And that's why the B in osteoblast is highlighted there, because those are the ones that go in and try to repair some of that tissue. And then the last of those are osteoclasts. All right. These are bone clashing or bone destroying cells. So when you damage a bone, these are the ones that actually go in and try to repair that process and kind of remodel that. All right, so the big thing there is that bone remodeling is done by both those osteoclasts and osteoblasts. Okay, it's good. All right. So the next thing we're going to talk a little bit about then are fractures. So fractures simply are a break in a bone. So if you ever go to the doctor and they tell you broke a bone or you fractured a bone, it's the same thing. I think a lot of times kids come into our room and they're like, oh, they just told me I fractured my finger. All right, well, you broke it. All right, it just depends on the level of break or the type of break, but they all are fractures. Okay, so there are a couple different types. They're broken up into essentially two different categories. So we have what are called closed and open fractures. So closed often are referred to as simple fractures. All right, and essentially what happens here is these fractures do not penetrate the skin. All right, so the bone, when it breaks, does not stick itself outside the skin. All right, open fractures, or what we call compound fractures, are ones where bone is going to penetrate through the skin. So there are several different classifications of fractures, and some of them can become open or some of them can become closed. And you can actually have a fracture start as a closed fracture, and because you moved it or somebody else moved it, it becomes then an open fracture. All right. A lot of times femur fractures are like that. So if somebody's been in a car accident and they smack their knee into the front of the dashboard as part of the accident, sometimes they'll break their femur about midline, and it'll be closed. And then in the process of getting them out of the car, it will become an open fracture because the end of the bone is pretty sharp and ragged. Okay. Pretty much all bone fractures are treated with two methods. We usually treat them by reduction, which means simply putting it back in place where it should go, and then immobilization. So usually casting or bracing or something on the outside to kind of keep them in place. There are cases where we have to put a piece of metal along the side of it, all right? Or there are cases where we actually have to put a metal rod down through the bone itself to kind of hold it in place. All right, but the key here is we want to try to realign it as best we can. Okay. All right, I'm going to post this. This kind of goes through a basic fracture video. It shows a little girl that breaks her arm, and then it kind of goes through the whole basic healing process for you. But I'll post that for you guys so you guys can kind of take a look at it. All right, so here are our basic common fractures. There are 6 different types. All right, so the first type you have is what's called a comminuted fracture. All right, comminuted fractures are simply where the bone breaks into lots of these little fragments. Okay. For me, I always kind of remember that this one is little pieces, right? Is because it has the word mini in the middle of it, M-I-N. Okay. I always remember that M-I-N means there's tiny little fragments of these bones in there, and that's essentially what we get here. Normally, these types of fractures are in elderly people. All right. So if somebody usually over the age of 80, 70 to 80, somewhere in there, depending on their health, all right, they will end up with a lot of comminuted fractures because these bones just kind of shatter because they're really brittle. Okay. The next one is what's called a compression fracture. All right. This is where bone actually gets crushed. Okay. Again, these are really common in older individuals, but they can happen in little kids. I forgot the disc. I'll try to remember it for tomorrow, and I'll see if I can't show it to you. But my daughter, I told you guys about her the bounce house, right, on Friday, and that's what happened to her. She actually crushed the top of her tibia. all right, because the bone was so soft, all right? So little kids a lot of times will end up with compression fractures, and then we just don't notice them on x-ray. The third one we have is what's referred to as a depression, all right? This is where the bone is pressed inward. The only place we're going to see depression fractures are in the skull. All right, somebody gets whacked in the forehead with something. You see it a lot not a lot, but you see it sometimes in MMA. Guy gets a foot or an elbow or something to the head, and he gets this kind of depressed, concave structure to his skull. And that's essentially what we have there. Sometimes we'll see him in baseball and softball because of a contact with a ball or a bat. Right, we'll end up with those. The fourth type that we have is what's called the impacted. All right, and this is where the ends of the bones are forced against each other. So two basic places we normally see these are in the shoulder girdle, so the humerus gets shoved up into the scapula, and in the pelvic girdle, the femur gets shoved up into the pelvic bones. Okay. Another one we see is what's called a spiral fracture. All right, so spiral fractures. All right, we get this kind of ragged break because the bone twists as it goes. And normally you can kind of tell this because the break itself actually has an S shape to it. Because you can see one side and then another side of that bone. I think later next week we'll do a little bit of some kind of work with pick images of fractures, and I'll show you that. Normally they have this really high angle of kind of reflection in the fracture is what we normally see. And then the last one we see are these kind of ones that we normally see in kids, which are called green stick fractures. All right, where the bone actually bends, it doesn't break all the way through. All right, little kids, and even I would guess some of you maybe still have fairly soft bones, and your bone will actually bend well before it will actually break. Okay, I had a volleyball player. For some reason, he punched something before their game started one time, and he came in and he's like, he goes to close his hand and closed his hand. His pinky went all the way across his hand, like it turned. Well, he broke his fifth metacarpal, is what he did. We call it a boxer's fracture. But on X-ray, it wasn't actually broke all the way through; it was bent, right? And it was splintered on one side. So think about like breaking a pencil or breaking a toothpick. It gets that kind of fraying or splintering on one side, and then it doesn't actually break all the way through the other side. These are really common in kids, again, because the bones are so soft. They won't actually break all the way through. Okay. For repair of those fractures, there's kind of a four-step process here. Okay. So the first step here is what's referred to as just a hematoma. So this is where blood will kind of fill in that gap between the bones. Okay. So this is why a lot of times when people break something, they say it will swell worse than when they sprain it. Right. That's not always the case. Normally, if you have a broken bone and it starts to swell, you will start to see discoloration on the skin. You'll get that black and blue kind of mark very quickly. All right. Whereas with a sprain, you won't normally get it. You'll get it days later. All right. But with a fracture, it usually happens pretty fast. All right. So this hematoma, this is that first picture here, kind of fills in that space where the bone has been broke. All right. And a lot of times we get this kind of lump or this kind of bumpy area around the outside of the fracture. Okay. The second part that we have happen is the bone is then splinted by fibrocartilage, and it forms this callus. All right. And that's kind of what we see here is this extension of this bone tissue on both sides. A lot of times, if you were to like slam your finger in the door or something like that, you'll sometimes feel that bump on your bone because the bone itself didn't break, but you dented the outside of the bone enough. I was helping a friend of mine move, and we were moving I think it was like an elliptical machine or something. So I had picked up the back of the elliptical machine inside of a car so he could push it in. And when he pushed it in, he shoved it so far forward that my hand got wedged between the front seats and the machine. All right. Well, it crushed one of my fingers, but didn't break the bone. It was just enough to kind of dent the bone. So then about 2 weeks later, I have this bump on the side of my finger. And sure enough, I went and had it x-rayed by our team physician here at South, and I had broken it. All right. But I still had use of it, but it didn't break it all the way through. Okay. After that, then that fibrocartilage gets replaced by a bony callus. So we start to see this more kind of harder lump to it. That's probably what I had when I went and got the x-ray taken of it. All right. And then finally, the bony callus then is kind of remodeled and replaced by permanent patch. All right, but if you notice, the bone still has a little bit of kind of an external lump to it. All right, this is why a lot of times they will say that if you break a bone, you're less likely to break it again. All right, because the bone will be repaired stronger than it was the first time. All right, so a lot of people who break their clavicle, you can tell that they've broken it just by kind of palpating their clavicle because they'll have a lump in it someplace. All right, or if you take an X-ray of somebody, you'll see that repair on the X-ray. Okay. Changes in human skeletons. So this picture over here is an image of an embryo. All right, a very small infant, and you notice not all of their bones are complete there. All right, you're missing a lot of the bones here in the wrists. All right, a lot of their pelvic bones still are really kind of soft. All right, so normally when you see an X-ray of a little kid, you're going to see that not all of their bones are actually there because in embryos, that skeleton starts out kind of as hyaline cartilage. All right, this is one of the reasons why babies can fold themselves into weird shapes. Okay, and also the reason why when they fall down and kind of bump themselves, they don't get hurt like the rest of us do, because that skeleton is so much cartilage that it's actually really soft and spongy. Okay. As we change, though, that cartilage gets kind of replaced by bone. And then in humans and adults, there are really only three places where we still have cartilage. All right, the bridge of our nose, that's still cartilage. The sections that can join our ribs to our sternum, that's also cartilage. All right, our ears are mostly cartilage, that's not on here. And then in between all of our joints are the only places we really still have any cartilage left. Okay. We talked a little bit about this earlier, this kind of bone growth that happens at those epiphyseal plates. Those are the growth plates. All right. Bone gets added essentially to the ends. All right. Doesn't really get added in the middle there. Okay. I'm going to skip a couple of these. We don't really need those. So, all right. This is the last little bit that we need to talk about then today is conditions. All right. So, there are some conditions specifically associated with joints. The main condition that we talk about is what's called bursitis. All right, it's the inflammation of the bursa that actually sits around the joint. So pretty much every joint we have has a bursa sac, a little sac of fluid that goes next to it, and it's there to help protect the joint as well as protect the tendon that has to go across that joint. All right, and a lot of times we'll end up with some bursitis and things in those kind of joints because of that. Another one we can get is tendonitis. All right. Itis essentially means inflammation. So anytime you see the word itis at the end of a word, we always know that's inflammation. All right. So tendonitis is inflammation of the actual tendon, the sheath around the tendon. Okay. There's another one you can get that's called tenosynovitis, which is actually inflammation of the tendon inside the sheath. Okay. We have arthritis. There's several different types of this one. Okay, but most arthritises are some sort of degenerative disease. All right, I think we're going to talk about a couple of them. All right, so you get what's called osteoarthritis. Osteoarthritis is normal wear and tear. All right, most older individuals that just have kind of led a fairly active life or had some sort of a manual labor job probably are going to have some osteoarthritis as they get older. All right, it's the most common type. Right, but essentially what you get is this kind of wearing away of the ends of the bone, the cartilage specifically. Okay, you can also get what's referred to as rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. So the immune system is attacking the joint tissue. Right? The big difference here with rheumatoid arthritis and osteoarthritis is rheumatoid arthritis normally is bilateral, meaning that you'll see it in both hands, both feet, both knees, whereas osteoarthritis a lot of times is unilateral, only on one side. Okay? Rheumatoid arthritis most often leads to deformities. So if you've ever seen an older individual whose fingers are all twisted and kind of swollen and kind of weird shaped, they most likely have a little bit of rheumatoid arthritis. Okay? We can also get what's referred to as gouty arthritis. All right? This one is caused by a deposit of crystals in the joints. right? And this one is usually diet controlled. So people usually eat a really crappy diet. It's really high in fat and really low in a lot of essential carbohydrates and proteins, right? When that happens, they get these crystals that actually form within the joint. And then the crystals actually break down the joint tissue, and then slowly over time, the bone itself starts to degrade, right? A lot of times they have a lot of inflammation associated with them. So when they have this arthritis, this gouty arthritis attack, usually the whole limb or the whole hand or anything wherever it's at will swell up. Right? It can be really painful, but again, it's usually pretty well controlled by diet. Okay, another one we can see is what's referred to as rickets. All right, this is a disease in children where essentially the bone fails to calcify. Okay, this usually happens a lot of times in some of the weight bearing bones that we have. All right, so they get this kind of bow legged appearance to them. Okay, this can also happen, and it's not really rickets, but it can happen to younger kids if they try to walk too early. All right, their bones aren't ready to accept that weight, but a lot of times parents will push kids to walk early, right? Because it's easier to just have them walk places and carry them all over the place. But a lot of times you'll see that if you see a little kid that's between 1 and 2 and they look like they're a little bit bow legged, it's because those bones are not really ready to accept that weight just yet. Okay. Another one we can have is osteoporosis. All right. This is where the bones start to become thin and also porous. All right. That's where the name kind of comes from. So you can see healthy bone over here on the left-hand side, osteoporosis bone over on the right-hand side. This is really common with old age. All right. And it's more common actually in females, and it has more to do with hormone production. Females don't produce as much testosterone. Remember, we talked about it. They do produce some, but they don't produce a lot of it. So as they age, their estrogen production declines. All right. And that is what also helps them with their kind of mineral and bone, their mineral storage in bone. So that will kind of end up with that. All right. Usually people with osteoporosis have this really kind of curved spine. All right. Sometimes they refer to that as kind of a buffalo hump on the back, but they usually have that kind of, they have that really far forward fetched kind of posture. Okay. All right. We'll go ahead and stop there. Stop that for those guys.